we're going to get into the slides. And I've got more slides than we may well show, and that's perfectly fine. My primary goal is really more as a fellow human being than as a psychiatrist, to think about what is it like to thrive in life as opposed to just surviving. Because my own thought is that probably from the age of 5 or 7 on, we really, at some level, have those thoughts. How well are we doing in life? Are we becoming what we want to become? So forth and so on. And obviously, there are very special challenges in thriving as one goes through the cancer journey. And we're going to talk some about that. But I think the general human challenge that we face is pretty much universal throughout life for all of us. And I want to talk a little bit about kind of the history of cancer and thinking about cancer from kind of a, quote, psychological or human standpoint. When I was young, well before I went to medical school, which was in 1970, in the 50s and 60s, cancer was a word that was commonly never described or talked about. There was great debate in the healthcare profession whether you should even tell a patient that they have cancer or not. The reality is that really until late 50s, early 60s, we had very few effective treatments for cancer. We had very limited ways of actually diagnosing cancer. So it was a frightening term, frightening disease, and the healthcare professions often had very little to offer in helping patients and family members. Then over the intervening years, we began to develop much more effective treatments for cancer. Back when I was starting in the medical world, the 5-year survival rate for children with cancer was 20%. It is now 80%. It's one of the great triumphs of modern cancer care is in that realm. In general, on average, 30 years ago, the chances of surviving 5 years after the diagnosis of cancer was 50%. It's now close to 70%. So there have been extraordinary improvements in how we are able to, want me to stand? All right, so they want to see me. You may regret it, but anyway, we'll conform to that. So then there came to be the time when we said, well, people are living longer after cancer, we're doing better. Maybe we should start paying attention to what it's like for them as a human being after they go through cancer treatment and during the ongoing part of the cancer journey, whatever part they go through in their life. And it was about 30 years ago or so that the National Cancer Institute established the Office of Cancer Survivorship, which was the first time the government really took seriously the question of how do we really understand and help these people who are going through cancer. And for a long time, the idea of being labeled a cancer survivor said you have to live 5 years and then you're a survivor, which was ridiculous. So the Office of Cancer Survivorship and many others in the profession said, look, we really have to understand that from the moment of diagnosis forward, that person is a cancer survivor. That actually was a major advance in thinking about the role of the cancer care system in caring for people. Then, and if you look at the history of my field of psycho-oncology, psychiatrists and psychologists and researchers and so forth, much of our early work was looking at what are all the stresses that cancer patients have, which are real and complex, okay? And what are the symptoms that they have, anxiety and depression and so forth. What are the traumas that they experience? And kind of focusing on what I would call the more problematic, troubling, quotes, negative aspects of the experience of cancer. Then over the last, say, 10 or 15 years ago, people begin to think, well, you know, the reality is many cancer patients do very well in coping with their cancer and rebuilding their lives. And we need to look at such things as post-traumatic growth and resilience and all of the positive ways in which people are able to put their lives back together again. And It's in that context that we came to the term, which is coming to be much more commonly talked about within the healthcare professional world, and is much more, I think, appropriate, and that is thriving. And we're going to talk about some definitions of thriving in just a minute. But I want to put, before we go on, I just want to talk a little bit about Harold Benjamin, who many of these pictures over there, and it's over there with his wife and the two founders of Cancer Support Group. Harold Benjamin was a lawyer whose wife developed breast cancer at a very early age. He was, I would say, probably the first important voice in the world of cancer care that said we have to think about a model how people actually, in fact, using our current term, thrive with cancer. He said patients need to be informed. They need to be empowered to take an active role, not only in managing their disease, but recovering their life and lowering their risk for recurrence. And they need to be part of a community where they have support. So that was really his founding vision. And I can tell you, because I was at UCLA at the time, this was seen as quite controversial. Amazing as we look back at it. But he was absolutely right. And if we look at what the cancer support community, you know, they came together with the Gilda's Club a number of years ago and renamed it the Cancer Support Community, which is fine. So, but he's a very, very important force. And the cancer support community, in my view, has become a wonderful force in this whole world of how, in fact, do we help people thrive with cancer, and how do we support them, and how do we educate them. And it's clear just from listening to the conversations before we started, a lot of people who enjoy talking with each other, and that seems to be quite a sense of community, even though many of you may not really know each other very well. That's really what this is really all about. All right, so I want to go through some slides. And again, my purpose is not to tell you how to thrive with cancer. You are each on your own journeys. You know how you're doing, you know how you're surviving, you know how you're thriving, you know what the challenges are. But to lay out some of the general ideas that may be useful and helpful to you as you look at how you increase your own thriving with cancer and support each other in that journey. All right, so let's go into the next slide. This is a slide that I always show in any context. This is from the Institute of Medicine in 2008, which was one of the first major, it's actually a book, that said, how do we think about how we care for people with cancer, going beyond the medical or cancer treatment and so forth. And they laid out the cancer care continuum, and some people go through initial diagnosis and then treatment and do well. Cancer never comes back and live otherwise a normal life. And some people, in fact, progress through these various aspects of their cancer journey. But I want to go to the diagnosis in the blue arrow there. They said, and they were right, we're going to talk some about what the cancer care system should be doing to help care for people with cancer and their family members, but unfortunately don't always do. They said there needs to be care planning. Patients need to know and understand what their options are, help make decisions with their treatment team as to what is the best course of action for them. They need palliative care. And I have to comment just a real, they need psychosocial support, and that's what cancer support communities of that and many other organizations, so forth and so on. They need to be able to be involved in everything that can manage their side effects and lower their risk for long-term side effects, and help them lower their risk for recurrence of cancer. Because there are often, in many cancers, there are things that can be done in terms of diet and exercise and so forth. And there needs to be support for family caregivers. And as you probably know, Rosalind Carter was very much involved in bringing to our national attention, caregivers have a lot of stresses. We need to do a lot more than we actually do even now as a country to understand and help support caregivers. But anyway, this is, I think, a very, very important model. I do have to say something about palliative care if we don't really honestly get to it too much at the end. I'll let you other slide. One of the most unfortunate terms we have in the English language is palliative care. And I'll tell you why. It's not understood either by many healthcare professionals, by the general population or many people who are undergoing treatment for chronic disease, okay? The goal, the real goal of palliative care, and it's the Brad term, my term for it, and many major institutions, City of Hope, Cedars-Sinai, have changed the name of their services to supportive care medicine, which is more accurate, it's more acceptable, it doesn't carry all of the negative baggage that term palliative care often does. But the Institute of Medicine was right. People should have access to the services of, quotes, palliative care from the moment of diagnosis forward. People can have very significant symptoms from the moment of diagnosis that need to be well managed. Pain and fatigue and insomnia and anxiety and many other physical symptoms. People need to be communicated with about their treatment, about the treatment plan and their options and their goals and priorities and so forth. And when it's well done, quotes, palliative care, my term supportive care medicine, in fact should be available to every single person diagnosed with cancer from the moment they're diagnosed onward for the rest of the time that they want it and or need it. All right, let's go on to the next slide. So thinking about thriving, this is my views on what are the big dimensions of life in which we live, big domains, and what are the ones that can be affected by especially by the diagnosis and treatment of cancer, and how do we think about thriving in the context of what thriving is about. So we live in the physical domain and all of the aspects of the physical domain, health and so forth and so on. We live in the psychological domain, thoughts and feelings and behaviors and so forth. We live in the world of social relationships. And from the moment of birth forward, and really even before that, the fetus is in some kind of relationship with his or her mother. So social relationships exist from really throughout life. We live in the world of productivity and a vocation life, education, career, jobs, so forth. And we live in the world of spirituality, whether or not we're formally religious or not, or affiliated with a particular religious group organization. I would say it's a very rare person who does not have a spiritual sense of life. What is the meaning of life? What is the purpose? What are the values? What is my purpose? How can I live a life that is desirable, acceptable, respectful, and so forth? So these are the dimensions of life, it seems to me, as we're thinking about thriving, that one can in fact consider. Next slide. These are some definitions that I came across. One of them, I think, was actually developed by artificial intelligence, if I understood it correctly. First time I've ever come across anything, but I think it's reasonable, so I'll go through these. Thriving after cancer diagnosis and treatment means more than just surviving. True. It involves actively focusing on well-being and living a fulfilling life. This can include adopting healthy lifestyle habits, managing emotions, participating in activities that bring joy and meaning. Pretty good definition, even if it is from my eye. Another one from a publication organization called Cure Today. A survivor is a person who's lived through hardship or disaster. A thriver is more than that. It is someone who not only goes through an exceptionally positive or threatening life event, but shows subsequent growth because of the experience. Okay, that's an important one. Now, the most important one, because I thought of it just myself, a person who is flourishing, that's a term I particularly like. Optimally, in the context of their life circumstances, there are lots and lots of stresses and traumas and losses and so forth in all of the interrelated major life dimensions we've talked about, physical and psychological and social and vocational, productive and spiritual. Okay, that's my own definition for what it's worth. And really my purpose today primarily is to provide some thoughts that may be useful to you as you think of your own life and how you're thriving and where you're not thriving and what would help you to thrive at a higher level that's important. There is no such thing as a single guide to thriving. If there was, I would have written it, I would be rich. Next slide. Exactly. So this is the next couple of slides, just deal with something that you all know and they apply to each of you at some level individually, but are part of the ways in which cancer and its treatment can negatively affect thriving. The whole world of cancer itself and all of the toxicity and treatments, from treatments, chemotherapy, systemic treatment, radiation therapy. Common symptoms. I have another slide about symptoms. Pain, fatigue, insomnia, others. One point I want to make now, in case I might otherwise not get to it. What is the most common, personally significant symptom in cancer? Many people would say pain. And pain is certainly common. And I spent much of my life running a cancer pain management service at Cedars. But the most common symptom actually is fatigue. And if you look at it, the evidence, the most disabling symptom is in fact fatigue. And many, many patients have significant fatigue. I have a close friend just diagnosed with ovarian cancer, who's going to have her surgery on Friday. And her major symptom, over and above all of the anxiety she has, is her fatigue. Before treatment, is profoundly fatigued, greatly interfering with her life right now. So just to make that point, and as we'll talk about maybe a bit later, the reality is there are treatments for fatigue. For all of the symptoms I'm going to talk about, it's important that you have a ability to communicate with your cancer care provider system.
You have no allegiance.
They know and understand the symptoms.
Yeah, I'm muting them.
Oh, okay.
Okay. All right. So
Who has control?
yeah, I'm going to go on, but these slides from my standpoint are perfectly available to anybody who would ever want them for any reason, okay? Just so you know that. And so I don't want to necessarily talk in great depth about each of these areas other than to say they're each important. And if you think about yourself in your own life and how cancer and its treatment has affected your life, I think it is useful to think about it in view of these dimensions and what impact it's having in these various dimensions of your life, how you're recovering, how you're showing resilience, how you're coping, and as you think forward, how you want to, using my non-patented term, flourish. Okay, I like the term flourishing because to my mind, it really says, how do we continue to grow and develop, and expand our life, and achieve goals, and so forth and so on. Anyway, next slide. I think you're going to have to stop me about a third of the way through. But kind of let me know where I am in terms of, okay. This is actually from a study that the cancer support community, it has an ongoing study. This is a report from this so-called Cancer Experience Registry for a couple of years ago about what are the concerns that cancer patients have. And I'm not going to go through them all other than to say they really involve all of the major dimensions of life that we have talked about, okay? For one individual, some individual concern in a specific area may be more important than others. But if you look at groups of patients, these are the common concerns that they report in this setting. Next slide. Same study looking at people who are Spanish speaking who have cancer. And there's many similarities, but also significant differences. And that simply makes the point that there are many social and cultural and economic differences of the life experience of cancer patients and they can impact on what they're concerned about and how much stress they're having in what areas and so forth and so on. And as we think about how we care for people with cancer, from my standpoint as a healthcare professional, really trying to think about and understand those cultural factors is really, really important. Okay, next slide. So what are some of the resources for personally optimally thriving? Okay. I'm going to go through and then I'll be quiet and see what discussion or thoughts that people may want to have. Okay. In the physical and medical domain of life, I think the most important thing for cancer patients is the quality of the relationship with their care providers, to tell you the truth. Is it supportive? Is it comfortable? Is it open? Do you have the sense of being cared about? And many cancer patients have multiple cancer care providers. Might have a medical oncologist and a breast or a surgeon for a while and radiation oncology. and other kinds of treatment. So it's often a very complex and kind of fragmented cancer care delivery system that people actually experience, unfortunately. That's really important. And all of the aspects that really have to do with how are you doing physically? What toxicity or side effects are you having from your treatment? Are you able to have your physical symptoms well controlled, like pain and fatigue, others that are kind of overlap symptoms like anxiety and depression and insomnia and many others? Are you able to maintain your daily activities, or are there real impairments in your ability to live your normal daily life? And are you able to participate in healthy eating and exercise programs, which may, in fact, reduce your risk for recurrence? So these are just some thoughts one could add or retract, but just some thoughts about what are the resources that are hopefully available to you as you look at how am I thriving or not in the domain of the medical and healthcare world and so forth. Can we go on to the next slide? Thank you. Psychological domain. Again, I'm not going to go over it in, except to make a few general comments about what are some of the resources. When we're talking about, in a way, the more positive aspects of thriving, which is really important, I think for most people, you actually get there if you're able to acknowledge the traumas and the stresses and the losses that you have experienced, and to actually come to terms with those. I can tell you, because I spent many, many years seeing lots of cancer patients in many settings, including hospitals. I can't tell you how many times I've seen a cancer patient in the hospital get bad news, begins crying, and the nurse or doctor comes in and basically says, "They're there, don't cry." Okay? Healthcare professionals, including cancer professionals, are often very uncomfortable with honest, open emotion, sadness, and fear, and loss. That's the reality of that world. But it's very important within yourself, within your social network, that you have the opportunity to grieve those losses and those traumas. We're going to get to it later, but I strongly believe based on my own experience with many, many cancer patients and other human beings, the ability to grieve a loss is one of the most important healing capacities that we have as human beings. And sometimes people don't feel comfortable grieving, they're not able to really grieve, and they carry a burden of loss for a long time that they don't need to carry. I'll tell you a personal experience. I have a cousin, now deceased, she was older. His 22-year-old son shot and killed himself in their home at that age. An incredibly traumatic, unthinkable experience. From all I could tell, she was never able to grieve that loss. And she really carried that burden, understandable the sense of loss, but never really grieved the trauma for the rest of her life. And so grieving is something that is so important for our own healing. And it's such an important human capacity that I would say, anytime you have the recognition of sadness or loss, trauma in your life, give yourself permission to grieve. And if you have a family member who should be grieving, support their grief. It's really incredibly important. All right. Coping, I have been impressed in my life, as I said, seeing literally thousands and thousands of cancer patients in many healthcare settings. How many people cope amazingly well with their disease and the treatment and the stresses of what they're going through. I've often said to myself, I think probably 80 to 90% of cancer patients thrive and cope better than I think I would if I was in their circumstance. So it's really amazing the human capacity to cope with very significant stresses and losses. And I think the last thing, one last thing I'll talk about, because we can talk about it all and I can waste your time, but value your spirit of independence while accepting appropriate dependence. Many people live in the life of I need to be independent and controlled and find it extremely difficult to accept needing help, being dependent. And of course, there are people who only want to be dependent as part of their life. But it's really important within yourself, if you're one of those people who tends to be very independent, to say, I'm going to accept the reality of being dependent for a while on a caregiver without feeling you've lost your self-esteem or you're not worthwhile and all of the other things that can go along with that. All right, and educational counseling and support groups, if you need, and cancer support community does a lot. And there are other organizations that are also important. And then the last thing I'll make, because I know for sure the way I'm going, I'm not going to get too slow. Talk a little bit about psychotropic medications for insomnia and anxiety and depression and so forth. I spent my life, like for instance with Cedars, in many cancer patients who were significantly depressed or big problems with anxiety, big problems with chronic insomnia, would be referred to me. I'd see them. Basically, when I suggested medication as part of an overall care plan, because it's never the whole care plan, it's part of it, you know, I'm taking too many medications already. I understand that. That was often, in fact, true. But it's very important to understand that medications can be your ally for a period of time, and that it's not a sign of weakness. Our brains are incredibly complex, and being able to alter our brains through medication at a time can be critically important in restoring one's quality of life. Next slide. Really, how am I doing here? All right. So again, we could talk about, and I'm not going to, but if you're really interested and find it valuable, you're welcome to have access to these slides. I think they're going to be, you know, at some point in time, and as I said, independently, these slides are open to anybody who wants. I just want to talk a little bit about the social, productive, vocational domain. One specific problem that's become an enormous problem in cancer care is what is being called financial toxicity. The costs of cancer care are absolutely extraordinary. The frequency of bankruptcy due to medical care costs is one of the horrific realities of our society. Okay. There are organizations who are involved. There's one called Triage Cancer. It's being recognized. People are not, to this point, really finding a solution of how we protect patients from extraordinary financial distress as a result of their cancer care. So it's a big problem. The other thing I'll just talk about in the world of spirituality, many people in our society have a Christian background or other belief system who, if they're diagnosed with cancer or family members diagnosed with cancer, basically say, how can God let this happen? It's an important question. It's a perpetual question. I don't have an answer to that, but it is important to recognize that spiritual distress is a very common reality in people who are particularly in the early stages of being diagnosed with cancer. And you need to look at, if this is important for you, look at all the sources of spiritual support that are meaningful to you. Whether it's a spiritual leader of some kind, whether it's the ability to talk with family members and friends and discuss these issues, because it's one of the important dimensions of life that commonly in the healthcare, cancer care world, we've tended to underplay. We had at Cedars, for the last number of years that I was there, a full-time chaplain who was a wonderful human being as part of our support care department. Okay, and that's a great model of how critically important we should take spiritual aspects of life and of cancer care. Next slide. I'll make a few comments about this. One of the unfortunate realities, as I see it in my old age, of our healthcare system is we've become really good at diagnosing and treating disease. Okay? We have not been so good at maintaining a sense of we're caring for a person, not simply treating a disease. Okay? And it's really important, as I said earlier, that you have hopefully a relationship with your primary cancer care providers, provider system, where you really feel that openness of communication and caring and so forth. And there's a lot they can do to help manage symptoms that you may be having if they know about them. But I know many cancer patients don't want to tell the doctor they're feeling anxious or depressed or having uncontrolled pain or whatever, because the internal thinking is, I think I'm a bad patient, they won't want to take care of me and so forth. A lot of fears of telling people, care providers, the truth. But I can tell you, you're never going to get best care unless your cancer care providers really know and understand the reality, not what you think they might want to hear. So that's one way. I'm going to talk a little bit about supportive care teams and community education services organizations. And if you're here, you know about cancer support community. There are other important ones. We're a national organization, very committed to doing everything that we can. And it's an organization I value from close to when it actually started, when I was still at UCLA. Next slide. This is my view of what are the professional resources that should be available to you as a cancer cancer patient, and some of them are important also for family members and caregivers. Most cancer care systems have an oncology nurse who serves as kind of a dance practice nurse, a nurse educator, so forth. That's a wonderful resource to have and should be universally available, in my view, in every cancer care setting. Every patient, in my view, should have access to an oncology social worker who is able to serve as really a navigator for all kinds of supportive care resources in the community and so forth and so on. The primary cancer care team may not know about, so forth. So everybody should have access to a social worker. Everybody should have access to an oncology dietitian to receive both education and clinical assessment and care. When I came to Cedars-Sinai to help develop our team there, we had dietitians, but they were kind of separate and not part of our service. And one of the first things I said, we need to have them as part of our service. I can tell you, you probably all know this, that a very high percentage of cancer patients need to have consultation with a dietitian, to be educated about diet, so forth. It should be a much more valued part of our cancer care system than it is. Rehabilitation medicine, very important part of cancer care and should be available. Formal survivorship care, which focuses specifically on the needs of patients who are in that phase of their life, and spiritual care, as we talked about. In my view, everybody should have access on referral for those who need it to a psychologist and or psychiatrist who has specialized expertise in cancer. There's not very many of them around anywhere, I can tell you, okay? And it's a specialized knowledge and expertise to have. A lot of patients don't need it, okay? But if you do, you need to get somebody who's really good and who really knows and understands all of the dynamics of cancer care. And then we've talked about tertiary symptom management, post-palliative care, supportive care medicines, and other. So this is a team that, in my view, every single cancer patient should have access to. Yes?
I think you're making an excellent point, and what I'd like to add is the person or a family member needs to advocate for the individual, because these services are available, but the oncologist or the person you're talking to may not tell you. So in advocating for yourself, you'll find out that these are available.
You're right. Although I have to tell you, there are many settings in which they really are not, unfortunately. Okay. But it is, in fact, a formal professional standard of care about these services. But the reality is that these standards of care are often not really met in the real world. Next slide. This simply makes the point that for patients who are approaching the end of life, that is a very important part of life, and they should have access to a team, supportive care medicine team, who really can help communicate with them and their family members and have discussions about treatment alternatives, their values, goals of care, and so forth, so that those decisions are hopefully made well in advance of the time when the patient may be imminently dying. Because I can't tell you how many patients and family members I've seen in which these discussions didn't occur within the family. They didn't occur with the cancer care providers. There's enormous family disagreement, distress, turmoil that's unnecessary and profoundly damaging and traumatic. So that's a very important part of our care system. I think I'm close to being out of time. All right, we'll go on. If you tell me to sit down, I'll know that we're through.
I feel more comfortable sitting down.
No, I'm fine.
Yeah,
That's fine. Next slide. We've talked a bit about this, but I do want to make this important point, which is kind of reiterating it. These are the 5 major common symptoms before you look at specific symptoms associated with specific cancers or specific toxicity: fatigue, pain, anxiety, depression, and insomnia. And I would say it's really important that each of those symptoms, that they're significant in the cancer patient's life, the primary team knows about it. If they're not able to manage it well, they help you get to professionals who have the expertise to manage it well. I would say that given our current knowledge that we have as a profession, nobody should experience high levels of cancer pain for any significant period of time throughout their entire journey. The reality is many people do have significant cancer pain. It's not well managed. And it's a very unfortunate reality that interferes with quality of life and certainly with thriving. Whole business of treatment side effects we talked about. Surgery itself may have profound impacts on one's life for a short period of time or a longer period of time. Next slide. I'm just going to, we've really talked about some of this already. I just want to reemphasize, and again, there are slides that if later on you want to look at it more. We've talked really about somewhat about traumatic stress and distress. Most cancer patients, I would say, experience significant trauma and significant distress at some period of time, and for some it's a very significant long-term reality of their life. That needs to be helped, whether it's through your primary cancer care team, with the supportive care team, whether it's through community resources, cancer support community. But it's a very, very important problem. I'm just going to talk a little bit about brain fog, or quote, chemo brain. Many patients experience this. In some cases, it's actually due to the effects of the cancer itself. In many cases, it's due to the systemic treatment, often the chemotherapy treatment. It can manifest itself with kind of cognitive fatigue, trouble focusing, slow thinking, poor concentration, impaired memory. And for many people, it's actually much more impairing to their quality of life than maybe they recognize, and that their cancer care teams fully recognize. So it's common. It's fairly common in patients who undergo radiation therapy, even if it's not to the brain itself, okay? I can tell you most radiation therapists who I've dealt with are wonderful physicians and so forth and so on. They tend to underemphasize both this issue and the fact that radiation therapy in many settings is associated with significant fatigue that only gradually resolves over about a year. Big problem, okay? So if you find yourself having trouble concentrating, slow thinking, so forth and so on, make sure you let your team know and get access to the care that can be provided. Not very many patients have profound, clinically profound anxiety or depression, but some do. Some people have a history of anxiety and depression well before cancer that made worse by that. But if you're having significant anxiety or depression, again, you need to make sure you get access to the right care. And in many cases, that may in fact be a psychologist and or psychiatrist who has specialized expertise. When I was, yes, ma'am.
So how do you know? I'm one who's very positive, and I think that it's my will that allows me to be positive. But deep down, I kind of wonder, am I dealing with the trauma? Am I dealing with the distress? I'm so into just do the next thing, do the next thing.
If you think it's working for you, I wouldn't worry about, am I not dealing with something, okay? In general, if you're really not dealing with something that you should be dealing with, you will find out. You'll have anxiety or depression or loss of interest in activities or some other symptom that says, this is real trouble, okay? But many people cope in ways that are very active as you're talking about, that are very focused, that are by nature or by response very kind of positive and optimistic and hopeful, which is wonderful. So I wouldn't worry about it unless you see something that makes you concerned yourself. There is no single right way to deal with all of the stresses of cancer, okay? But there is a right way for you. And that's one of my points I'm trying to make. You can know within yourself how well you're coping or not, how well you're thriving or not, and what domains you're thriving or not. And use that as a way of determining within yourself, what are the next steps forward for me to thrive most effectively? Because I would like to see every patient thriving realistically, but as fully as possible in each of those domains that we talked about. It's possible. I will simply make the point, occasionally patients with cancer become significantly depressed and suicidal. It's not a common problem, but it does happen, okay? And if you see that in yourself or in a family member, whatever, don't ever dismiss it, okay? Always take it very seriously. And your cancer care team needs to know about it immediately. And they need to take immediate steps to make sure that you get access to whatever the right level of care is to help you through that crisis. Next slide. I think we're not going to go through all of this, but they're available. But there is a point I do want to make at my end. Save some time for discussion. I made the point earlier on, it's possible to thrive even until the very end of life. Okay? And I'm going to tell you about one of the experiences I had 30-some years ago at Cedars that I will never forget. This was we had at Cedars at that time a world-renowned expert in sarcomas, which are tumors of the bone and muscles and connective tissues. He was treating a 12-year-old girl who was very close to the end of life and had very significant, poorly controlled pain. And so we had a cancer pain management service, and in an ideal world now, you would have people with specialized expertise in younger children and their cancer pain, but we didn't have that, so it was our service that was the resource. It happened that she was the daughter of a preacher who lived in Simi Valley. So they were referred to me, and I came into the meeting room, and she was there with her father. And the first thing she asked me was, am I going to die soon? Before anything else. Well, I was obviously taken back. Usually I would not have a discussion with somebody about their prognosis, certainly not with somebody I didn't know. So I kind of looked at her father to see if I could get any nonverbal cues from him as to how I should respond, but he didn't give any indication. My intuition was, and it turned out to be right, that I should tell her. So I told her, yes, the doctors think you likely will only live about another couple of weeks. So what was her response? Thank you. She clearly, and most cancer patients who are approaching the end of life, in fact, know it, but there's not been communication necessarily within the family or whatever. So we went on and we figured out how to help manage her pain. And we got her pain very well controlled, literally within a few hours. So a couple of weeks later, her father called our nurse and said that she had died the night before, and to thank us for the care she had received because her pain was well controlled and so forth. Here's how she spent the last several hours of her life. Sitting around with her friends, deciding to which friend she wanted to give which doll. Okay. Now the memories for her friends of this truly tragic end of life and for her family were as positive as you could possibly imagine. That's the memory that they have of their young daughter bravely facing her upcoming reality and sharing with her friends what was meaningful for her and for them. So that's, you know, it's to me a profound example of the fact that even until the very end, it is possible to thrive. And she did, and I will never forget that. I'm sure her family will never forget that, or her friends. With that, I am gonna sit down and be quiet and we can take questions or whatever.
I have a situation right now where I am feeling like I'm thriving. I've had 4 clear scans recently, so I feel like I'm doing well.